Compassion fatigue is that fatigue that we have where we can't basically recharge. And it's not so much all the compassion that we're giving to people that is draining, but it's really mirroring the distress of people around us and sort of absorbing that trauma from our patients, from our peers, from our family, which many of us have been exposed to throughout this pandemic. What happens is that we just can't re-energize. We can't get refilled to be able to do it again. And we're fatigued. We're drained as a result of that.
I think as physicians, we always want to be providing high quality patient care. None of us go into the profession, with the goal of not providing high quality patient care. But sometimes we're not really aware of what the concerns may be. If we don't actually stop and pause and take a look objectively at what's happening, there may be things that are happening that we don't even realize.
Really being interested in the person that is in front of you, and not just saying that in a superficial way, but actually really trying to take interest in what is this person's motivation, what is their beliefs, what do they want, and really seeing them as the person that they are and the humanity in that person. I think also recognizing your bias is really important to ensure that you're not making any assumptions going into these conversations, and then also trying to put in that work and trying to reframe your beliefs.
So many of the systems that we currently have in place that are meant to actually provide support and are meant to care for people, for all people, and I'm thinking in particular about the healthcare system, these systems are often not really constructed for or trained appropriately to meet the needs of trans and non-binary individuals in particular. And so there's often this sort of expectation in a lot of healthcare settings that every person is going to fit into the gender binary. They're going to fit neatly into these predetermined categories. And that makes it extremely difficult for trans and non-binary individuals to navigate and to fit into healthcare settings and institutional environments.
Virtual care is an example of demonstrating a necessary flexibility or nimbleness within the healthcare system. And we have to be able to be nimble and to adapt in a system like this where things feel sometimes as if they're crumbling around us. And we need to do that while still holding fast to standards.
I think it's very important in the policies to acknowledge physician judgment. I think it's really important that these policies go out for consultation so that physicians in the province as well as non-physicians have a chance to have their voice heard and to really encourage people to take part in that type of process and to know that those comments are taken very seriously as these policies go through their iterative changes.
Colonial biomedicine sometimes gets distracted or focuses its attention on certain pieces like prolonging life or treating symptoms or not missing something, though I think that at the end of the day, finding ways to really respect the reality of suffering and to find ways to accompany people in their suffering without feeling like we need to fix it or avoid getting blamed for it.
When we're interacting with patients as clinicians, I think we often have to think about how their identities shape their lives and their experiences in terms of what structures they come into contact with in this world. So by definition, interacting with a racialized woman or an undocumented woman or a trans or non-binary person means that they will be impacted differently by the structures that exist in society.
People are still struggling to a certain degree to accept perhaps that they have a condition, to accept that the condition requires certain treatment, perhaps sometimes certain restrictions. They might see that or take it personally. But when it comes down to it, I think a large part of that has to do with either shame, again, internalized stigma, this false idea that a doctor should be this way and shouldn't have a condition, and that when there are these asks, the resistance, I think, is often fueled by that underlying struggle.